is that all the talk going on right now about the healthcare system due to the recent smashmachination of a certain CEO, I thought I would add in my 2 cents. You see, I'm about a week out from a 72-hour hospital stay where I was admitted for surgery after showing up in the ER and complaining of pain just above my diaphragm and below my sternum. Now, I've had this pain before, and when I went into the ER, I told them that I thought I was having an esophageal spasm. But instead I was told, no, you need to have your gallbladder removed. That decision was made after a single x-ray was taken in the ER, and I did not feel comfortable with that diagnosis. I was admitted, and after 72 hours, they still could not figure out what was wrong with me, and I had to literally beg them to let me leave. During that time, I was subject to the following examination and medical procedure codes. I had an EKG in the ER. I had an x-ray in the ER. Then I was admitted. While on the acute care floor, I had an MRI. I was forced to take a pregnancy test, even though I can no longer biologically have my own children because I voluntarily had both of my fallopian tubes removed. And I was subject to a CT. I was also subject to 8 or 10 different exams by different providers. Today I log into my insurance company and I find out that all of my exams were denied. Each of those exams average around $400. I had 8 of them in total while I was there. Right now, my bill is an estimated $4,000. They're still not done with all of the claims. I have health insurance. I actually have really decent health insurance, and they're denying my claims. Why are they denying my claims? From what I can tell, they're denying the claim because the provider was out of network and they're saying that it was not medically necessary. I'm laying in a freaking hospital bed. It's not like I have the choice about what fucking doctor is going to walk in my room to do an exam. Fortunately, I know how to fight an insurance company. In fact, I made a living doing it for 7 years. And these people, God help them when they answer the phone because they have met their freaking match. But for the majority of Americans who do not know how their health insurance policy works, these bills are a situation that most people are not set up to handle mentally or financially. And because I had health insurance, the hospital did every single thing that they could to charge my insurance policy during my stay. There is a serious problem with the insurance and medical communities in this country. And it is the exact reason why you see the apathy that you're seeing from the American people as it relates to this mismachination of this CEO. We do not care because this system that is supposed to be in place to help us does nothing but hurt us. And the hospitals are just as complicit as the insurance companies are. The hospitals are complicit because their policies are not set up to serve the patient. They're set up to serve the hospital. Why was I given an EKG when I walked in? I didn't have chest pain. I made that clear. Why was I given a pregnancy test? I can't have more children. My insurance is not going to pay for a pregnancy test when they just paid to take my fallopian tubes out less than 2 years ago. The hospitals don't care. The insurance company doesn't care. And guess who gets stuck with the fucking bill? Average people like you and I. I would like to just anecdotally say that this is not an attack on physicians, but the corporations that these physicians work for could give a shit about what happens to me. All they care about is that they remain profitable. All the insurance company cares about is that they remain profitable. And that is the reason that you are seeing the response that you are seeing. We're done. We're tired. We're exhausted. The system that was set up to serve us does not serve us. And the people are starting to fight back. And if corporations continue to put profits before people, you will see more stories like the ones you saw this week.